So good morning students. Next class, that is a posterior cranial fossa. So before going to discussion the posterior cranial fossa, we'll discuss once again, repeat that anterior cranial fossa, posterior cranial fossa, what are the structures passing through the foramens. So, and from the anterior cranial fossa, one is the foramen cecum. Structures are, one is the vein, that is a vein which is extending, that is passing, drains that is the nose, from the upper part of the nose, that is going to reach to drains into the superior orbital fissure. That you know, this is a foramen cecum. Next, here we can identify the anterior and posterior ethmoidal foramens or the canals. Through this anterior and posterior ethmoidal vessels and nerves passing. Next, here we can identify this is the optic canals. Through this we can identify that is the optic nerve, that is second cranial nerve. Next is the ophthalmic artery. These two going to reach to the orbital cavity and supplies to the orbit, that is the eyeball and extraocular muscles. Next is the superior orbital fissure, you know, that is bounded anteriorly by the lesser wing of the sphenoid bone and greater wing of the sphenoid bone. Here we can identify the superior orbital fissure. This fissure is separated lateral part, middle part and medial part. That is the from lateral part, lacrimal nerve, frontal nerve, trochlear nerve. Next is the superior ophthalmic vein from the lateral part. Whereas the middle part, upper and lower division of the third cranial nerve, oculomotor nerve. These two divisions separated by nasociliary nerve. Next is the opticent nerve from the middle part of the superior orbital fissure. Whereas the medial part, it is rounded, wider. Through this only the one vein, that is the inferior ophthalmic vein, is passing. That is superior orbital fissure. Next is the foramen rotundum. Here we can, I told already, just below this anteroclinial process, here we can add a rounded foramen is there. That is this is a rounded foramen. That is the foramen rotundum. Through this, that is a maxillary nerve, maxillary division of the fifth cranial nerve is passing. This is a foramen posterolaterally, foramen ovale is there. Through this four structure, M-A-L-E, male structure. M means mandibular nerve, A means axillary meningeal artery, L means lesser petosa nerve, E means emissary vein. These are the four structures passing through foramen. Posterolaterally, foramen, this is a foramen spinosum. Here we can identify through this middle meningeal artery, meningeal branch of mandibular nerve is passing. Next, medial side, just lateral to this body of the sphenoid bone. Here we can identify irregular foramen is, that is called the foramen lacerum. Through this lacerum, we can identify that is the but lateral part is narrow, it is filled with the cartilage. But sometimes we are identifying the emissary vein and also meningeal branch of the ascending pharyngeal arteries passing. Whereas the medial side rounded structure foramen is, that is carotid canal or the carotid foramen. Through this internal carotid artery, and carotid artery is covered with the sympathetic plexus. Next is the foramen. This is the next this is the hypophyseal fossa. Here the pituitary gland is lodging. So these are the foramens are present anterior and middle cranial fossa. Next, now actual topic is the posterior cranial fossa. It is a deeper fossa. Posterior cranial fossa is a deeper when compared to the anterior and middle. So it is anteriorly bounded by this petrous part of the temporal bone. These two anteriorly, and this is the dorsum sellae. This sloping part is there, that is called the clivus. Next, lateral side we can identify the mastoid, that is the mastoid part of the temporal bone, and this is the squamous part of the temporal bone. In the center we can identify big foramen, that is called the foramen magnum. So these are the boundaries. Anteriorly, this is anterolaterally by the petrous part of the temporal bone. In the central dorsum sellae and the posterior cranial process, this is the clivus part. And this side we can identify the mastoid process of the mastoid part of the temporal bone. These are the squamous parts. Here we can identify this to the fossa for the cerebellum. This fossa is for the posterior occipital lobe of the occipital poles lodging here. and here the clavus, it is separated by the brain stem here. So while removing the brain, we are keeping here the brain knife. We are cut the brain stem like a medulla oblongata here, like this. This is a foramen magnum. So these are the boundaries. Here lodging the cerebellum, here the brain stem. This hind brain is lodging here. This is occipital. Behind also we can identify the internal occipital protuberance. Internal occipital protuberance. These are the transverse sinuses, or the sinus fossa is there. And also here we can identify the sigmoid sinus. Sigmoid sinus is extending and make internal jugular vein. This is a jugular foramen. This is called the jugular foramen. And also here one foramen is there. Just see. This is the foramen, internal acoustic meatus. And also here is another foramen is there. Hypoglossal canal. Here we can identify the condylar part of the occipital bone. This is called the base occipital bone. This is called the base occipital. This is the condylar part of the occipital bone. This squamous part of the occipital bone. Squamous part, base occipital bone, condylar part. So now we'll discuss from the central. This is a clavus, is the sloping part. Here lodging the in front brain stem, that is a pons, medulla oblongata is continuation. This is a foramen magnum. This magnum separates medulla oblongata. Above is the medulla oblongata. Below this magnum margin is the spinal cord. Here the pons, medulla oblongata is lodging. Through this structure, what are the structures passing? See here, through this foramen magnum, very important. Sometimes the short notes, short question also. See, it is oval shape, but anterior part is narrow. If you make there is a transverse ligament is attached to here. Here this part is separated by the dens of the second cervical vertebra is relation with this. So dens is attached to here. So this is separated by the transverse ligament is there. Then automatically this foramen magnum divided into anterior part is a narrow, posterior part is a wider part. What are the structures passing through this foramen magnum? So anterior narrow part, here only the ligaments, like one is a apical ligament of the dens ligament, that is apical ligament, cruciate ligament, and that is the membranotectorium. That is relation with the when you are doing the dissection of this suboccipital triangle, then we can identify the membranotectoria. This is anterior part. But whereas the posterior part is there, it is a large. Here through this we can identify the spinal, that is the lower part of the medulla oblongata. So which is there, hind brain, that is the medulla oblongata, pons, medulla oblongata is continuation through this foramen, lower part. And also three meninges covered with that is the medulla oblongata. That those medulla oblongata lower part, three meninges passing through this foramen magnum. And also subarachnoid space which is there, which is covered with the meninges to the spinal medulla oblongata. There is subarachnoid space is there, subarachnoid space. Through that space, spinal accessory now, spinal part of the accessory now, it is ascending through this foramen magnum. Next is the vertebral arteries. This vertebral artery is a branch of the second, that is a subclavian artery, first part. It going to reach to the sixth cervical vertebral transverse foramen is there. Through that vertebral artery is passing through these transverse foramens and extends to reach and through this the subarachnoid space and going to make that is circle of Willis. Next are also sympathetic plexus. Next is the posterior spinal and anterior spinal arteries, spinal cord, which is separated by the anterior and posterior spinal arteries, vertebral arteries, sympathetic plexus, medulla oblongata, lower part. Next is the three meninges. These are all structures posterior part of the foramen magnum, whereas anterior only the ligaments, that is apical ligament, membranotectoria, cruciate ligament, this anterior part. So these are the structures passing through the foramen magnum. Magnum means large. Next here we can identify the foramen, that is a hypoglossal canal. That is the 12th cranial now is passing through this hypoglossal canal, hypoglossal foramen. Next is this is the jugular foramen is there. Here we can identify the anteriorly it is relation with the that is the superior petrosal sinus. Next, see jugular foramen. This anterior part, that is the inferior petrosal sinus is relation with this, and meningeal branch of the ascending pharyngeal artery. Ascending pharyngeal artery is passing. Whereas the middle part is there. Middle part here we can identifying the three cranial nerves. 9th, 10th, 11th cranial nerves are passing through this jugular foramen. 9th, 10th, 11th cranial nerves, these are passing through this jugular foramen. It is extended, come up downwards and reach to the neck region and going to supplies to this. 9th is the glossopharyngeal, that is going to supply to the pharynx as well as the tongue. Next is the 10th is the vagus. Now you know that is the vagus course, that is entire neck region and thoracic region, abdomen region also. 11th is the cranial part and also spinal part is unite together and enter into the neck region, going to supplies to the sternocleidomastoid muscle and trapezius muscles. And also posterior part is there. Here we can identify the internal jugular vein. Internal jugular vein, it is found by the which is there drains the sigmoid sinus, and also internal jugular bulb and internal jugular vein is passing through this and enter into the neck region. Next is the not only this, and meningeal branch of the occipital artery also passing through this jugular foramen. This is the jugular foramen. See here. Next is the here we can identify internal acoustic meatus, internal acoustic foramen. Through this is relation with the middle ear cavity. So this is a foramen. Structures are passing 7th cranial nerve and 8th cranial nerve. 7th and 8th cranial nerves are passing through the internal acoustic meatus. Not only this, and labyrinthine vessels also enter into the middle ear cavity, and 7th is going to supply, you know that facial nerve, and also 8th is enter into this middle ear cavity, inner ear, and one is the vestibular part, another one is the cochlear part is there. So through this internal acoustic meatus, 7th, 8th and labyrinthine vessels, it is enter through this but not exit external acoustic meatus, not coming through this external. Sometimes the students saying what are the structures passing, how it is exit the nerves, they are saying external acoustic meatus, so cannot. So which it is a relation with the external acoustic meatus. Inside we can labyrinth, that is a tympanic membrane is there, no one structure coming through this, not coming, so don't say that. So you can say internal acoustic only the 7th and 8th cranial nerves through here, 7th and 8th cranial nerves, and labyrinthine, it is going to supply labyrinthine of the ear. Next, this is the internal acoustic meatus, jugular foramen, this is the foramen magnum, clivus. Next here we can identify the transverse crest is there. This is the internal occipital protuberance. Here we can identify attached by the falx cerebrum, posteriorly attachment, anteriorly attached by the crista galli and frontal crest. So here transversely sinus is relation, sigmoid sinus is here relation, that is the fossa or the sulcus is present here, and these are the fossas, that is the relation with the occipital lobe, that is the occipital poles of the occipital lobe of the cerebrum is relation here. These are the two deeper fossa, that is a cerebellum is lodging here, cerebellum. Next here we can add a lower part of the medulla oblongata and anterior part relation with the clivus. This is the clivus of the this is the basic occipital bone. This is the posterior cranial fossa. So now we are discussed already anterior cranial fossa, middle cranial fossa, this is a posterior cranial fossa. So in this we can expecting the sum of the questions. One is the foramen magnum, what are the structures passing through the foramen magnum. Next question is the foramen ovale, what are the structures passing through this foramen ovale. Next is the superior orbital fissure. Another fourth is the what are the structures passing jugular foramens. These are the some important questions expecting in the viva. Okay, this is the anterior, middle and posterior cranial fossa. So interior of the skull, so already we have discussed yesterday. This is a interior cranial vault. This is a frontal crest. This is a sagittal sulcus. These are the granular feet. This is a parietal foramens. This is the anterior division of the meningeal artery. Anterior division of the meningeal artery. Sometimes see, some point block. Sometimes they are keeping the gun here. So immediately that bullet very easy to bleed in this squamous part of the temporal bone. It is breaks the anterior division of the middle meningeal artery. This is a cranial vault, interior structure, interior, whereas this is a cranial cavity, interior anterior cranial fossa, middle cranial fossa, posterior cranial fossa. So go through the textbook. Once again you read what are the structures passing through the foramens. Okay, thank you very much.